know that breathing difficulty need not necessarily mean that the problem lies in the lungs or the respiratory system. It may also be because of cardiac causes or even central nervous system causes, like if a child is having fits, then also he or she may develop breathing difficulties. Friends, I am Dr. Timir Baran Sahu, Senior Consultant in Pediatrics and Neonatology at Apollo Hospitals, Bhubaneswar. Today we are here to discuss that what are the presentations and causes and symptoms of breathing difficulties in newborns. Friends, respiratory distress or breathing difficulty in newborns is one of the most common causes of parents bringing a child to the hospital in emergency or any child facing difficulty at the time of birth. It should always be taken very seriously because a child does not have the kind of time required for us to act slowly. So it has to be taken up on an emergent basis and treatment has to be very aggressive in such cases. First of all, friends, how do we identify such a child who is having breathing difficulties? First and foremost is the breathing rate. That if a child is breathing very fast, then that is the first indication that the child is facing a difficulty in breathing. Other than that there may be a noise also, a grunting noise during breathing, and a normal breathing should always be without any sound. It should be very easy. But if the child is producing a sound while breathing out, then that is an indication that the child is breathing with some difficulty. Other than that, there may be movement of the accessory muscles also. The chest may move a lot. The nasal flaring may be present, that is the nostrils flare up in these times. Children also show some changes in their color. That is, if the oxygen level falls, then the child may appear slightly dark or towards the blue side. In some cases, the child may cease breathing also, that is, stop breathing altogether. So these are the various manifestations of difficulty in breathing. Which brings out, friends, to the second part, that what causes these difficulties. First and foremost is that if the child does not cry at birth, which we call birth asphyxia. In such a child, obviously some help has to be given to support this child, and this is followed by a period in which the child breathes rapidly or develops this respiratory distress. Other than that, any kind of infection, whether localized to the lungs or spreading throughout the body, that may also cause breathing difficulty. Shock or any circulatory failure, this may also cause breathing difficulty. And even if the child is having any congenital heart disease and or a transient cardiac problem like pulmonary arterial hypertension, then all these may lead to breathing difficulties in the newborn. So friends, once we have identified that that the child is facing this problem, then how do we treat it? So treatment depends on the cause. That is, if the child is having infection, then we treat the infection. If the child is having some shock, then we treat the shock. So treatment depends on the root cause of the problem. So it is very important to identify the cause properly. In order to identify it, we need to have some few basic things in place, like a chest X-ray, like a arterial blood gas analysis, and the provision for a 2D echocardiography which can be done on bedside. So these are very important provisions for us to arrive at a proper diagnosis of the reason for the respiratory distress. Once we have identified it, which comes to the next part, that how do we treat such a case. At times it is as simple as giving a little bit of oxygen by hood, and if that doesn't work, then we may go into higher modalities, like we can use CPAP or continuous positive airway pressure, or we may use non-invasive ventilation. If this does not help, then we may intubate the child and go in for mechanical ventilation. A few centers are there that which can go beyond this also, that is, they can go in for high frequency ventilation or nitric oxide ventilation also. Another modality which we use in such cases is the use of surfactant administration. Friends, you must have known that many children who are born beforehand, that is before the time is due, those who are born prematurely, their lungs are not fully developed. So a medicine is instilled inside the lungs to fasten up the process of the maturity of the lungs, and this goes a long way in taking the children off ventilation very quickly. This is called surfactant. So these are the various modalities which we have at our disposal in order to help these sick children recover very quickly. To conclude, friends, respiratory distress in the newborn is an emergency which has to be taken very seriously and seen by the right people and treated at the right kind of center. Thank you.